Hello everyone, welcome to the InteresThing. Kenzie and I'm stuck in my house just because of some stupid virus. Never mind, this video is not about my quarantine day but it's about something else. Before we start, I have to ask you this. Do you believe in foretales? Personally, usually I don't. But if you search for the castle that quarantined the Rapunzel princess in the Tango cartoon 10 years ago, guess what is named? The Corona Castle. Sound relatable? Okay, but whether the Disney prediction about this pandemic is true or not wasn't the only question I had, but I'm also really curious about what the COVID-19 actually are. And we have a virus. We have a lungs. Lung with virus. But wait, why is our lungs but not our elbows are affected by this virus? And how the lung with virus can make us sick? To see how this virus impacts our neighborhood, have a look at these videos, check it out. It doesn't seem like a normal Monday of my city. Well, it seems like we're all afraid of something we just can't even see. Please take some minute for me to share with you what I know about this annoying species before rushing to the supermarket for toilet paper, for condom, for weeds, for guns. What? Guns? Okay. But okay, just kidding, please don't. Okay, let's see what we have here. A crown-shaped virus with many glycoprotein spikes as decoration on its envelope. So now it's clear that its name is inspired from the crown that the king and queen put on their head, but not a kind of beer. This human coronavirus family can be divided into two main groups, and not all of them cause severe problems. First, we have the alpha coronavirus. They can cause common cold and upper respiratory infection in normal healthy individuals, but in some immunocompromised subjects and elder, lower respiratory tract infection can occur. The other human coronavirus, including the SARS coronavirus, MERS coronavirus, and the SARS coronavirus 2. SARS stands for severe acute respiratory syndrome, while MERS stands for Middle East respiratory syndrome. Thus, the SARS coronavirus 2 belongs to the beta coronavirus category. Initially, we have the name of this virus is 2019 nCoV, but subsequently it's termed the SARS coronavirus 2 because it has a very similar structure to the one that caused the SARS outbreak in 2002. Probably you have seen some symptoms caused by this virus like shortness of breath or chest pain, fever, or dry cough. And now we will give you a deeper insight regarding the invasion process of this virus. They're transmitted mainly by two ways. We have the fecal-oral and the respiratory droplet. Okay, so now, pretending there is an infected person, he can even spread the virus before the onset of the COVID-19 disease. Now, the virus spread to the environment via the respiratory droplet or from the contaminated hand if he doesn't wash his hand properly after wiping his butt. And the virus can stay in the air, which is floating for about half an hour, or on the surface of many objects. It can last there for 24 to 48 hours, And if you inhale the virus or touch your face with the same hand you touch the contaminated object, you may be infected. Before starting the journey of SARS coronavirus in our body, let's talk a little bit about our respiratory tract. Okay, it starts from the nose or the mouth to the pharynx here and continue with the larynx, the trachea before branching to the left and right bronchi to guide the air to our lungs here. From there, it gives rise to a tree-like structure and terminates at the bubble, as known as the alveolus, where the gas exchange occurs. Inside this bubble, there are two main types of cells, which we call the type 1 pneumocyte, or the green cells here. They are responsible for the gas exchange between the surrounding capillaries, the vessels here, as drawn in red, and the bubble. And then we have the type 2 pneumocytes, the cells in yellow here. They secrete a very important substances, the yellow substances here. We call it the surfactants. It helps it to help to keep a balloon inflated. Back to the virus. It follows the mentioned pathway to reach this bubble where everything starts to get nasty. The spikes is recognized by the ACE2 receptor of the yellow cells. The spike of the virus is comparable to the key, and the ACE2 receptor here is like the lock of the yellow house here. Because the key is recognized specifically by these yellow cells in the lung, that's the reason why the lungs are main targets for this virus. It can only enter these cells, the yellow or the type 2 pneumocyte. After getting in, their replication activities destroy the cells. At this point, the virus can be considered as a burglar that breaks into your house. But the yellow cells, then the house calls for the security, which is the macrophage. And this security guy will try to get rid of the infection by two main mechanisms. First, he eats the house, smack it and break it, together with the virus inside, and hopefully we'll be able to get rid of the virus. And then he sent an emergency letter, which are the chemokines, including the interleukin 1, interleukin 6, and TNF-alpha. You don't need to know that, but you just know that that's some kind of emergency letters to recruit the police or the neutrophil, who usually stay around in the circulation here. And then the neutrophil will help him with his job. However, these carbs are not very tight, so the neighborhood healthy cells can also be damaged. Unfortunately, these neighborhood cells are responsible for gas exchange, as I mentioned, thus the gas exchange process is also disrupted. A very important event caused by these emergency letters is the vasodilation. When we need to recruit such a high amount of cops, so many cops we need to come, so we need to widen the road in order to avoid the traffic jam. So as a secondary consequences, fluid can come out and accumulate in the space around the bubble, then applying the pressure to it. Moreover, fluids can also leak into the lumen of the bubble and prevent the action of our yellow substances, so they can't do their jobs, and again apply another force to further shrink the bubble. Because of so many forces act on our bubble, so our bubble or alveolus under this condition may collapse, making it super difficult for the patient to breathe, sometimes even suffering. So if the inflammation spread to many places in the lungs, this condition is called the ARDS, or the acute respiratory distress syndrome. The number one cause of death of the SARS coronavirus 2 patients. And the signal gets into the circulation and reach the hypothalamus here, a region of the brain, thus where one of its functions is to modulate or to control the body temperatures. This center raises your temperature, leading to the fever. As you may know, the last scenario you want to expect is the involvement of all other organs in this mess. So You remember the vasodilation or the widening of the street by the emergency signal is not only leak the fluid to the lungs, but also to the kidney, to the liver, and the heart. And all these organs are not very happy, they go on strike. We have multi-system organ failures. To sum up the possible outcome of this SARS-CoV-2 infection, let's have a look at this graph. We have a wide spectrum of illness severity, from asymptomatic infection or mild with no or mild pneumonia for 81%, and severe disease about 15%, and we have the critical disease with respiratory failures, hypoxia, low of oxygen level, or shock, and multi-organ dysfunction for about 5%. According to an article on uptodate.com, at the time when it was published, the overall case fatality was 2.3%, and luckily no deaths were reported among the non-critical cases. The virus is bad. It's crucial, it hurts the people, it's harmful for the communities, but at least that virus is not sexist or racist. It doesn't call itself the virus of any specific country. It's spread equally among the genders, nationality, especially when one doesn't have enough protection. However, the outcome of the infection, as you already seen, may differ among the target immune systems or the age, and people with a high risk to develop the severe forms are those with suppressed immune system, or the old, or you have chronic disease, or someone who already have their respiratory pulmonary problems. They will need the best protection possible to avoid unwanted consequences. The healthy carrier may not have life-threatening effects for themselves, but it can act as an intermediate through spread the virus and taking the breath of the others. And also, you may not know if you're really lucky or not. So it's better just do what the World Health Organization tell us to do. We stay work for you and you stay at home for us. Fair enough. Talking about the approach to minimize the damage of this pandemic, I've heard that the UK government mentioned the aims of 60% infected population to achieve their herd immunity. And this seems to be a very interesting topic. And in the next video, I will share my view regarding the problems such as the updated medical interpretation like vaccine, antiviral, or quarantine, or the possibilities for carriers to have false negative tests for COVID-19. So stay tuned and let me know how I can improve my upcoming videos. See ya!